All right, welcome back to the deep dive. So we're jumping straight into a listener question today, and it's a big one.
A really important one, I think.
Yeah, it's about hair regrowth treatments and this uh, this really scary phrase you see online, irreversible side effects. And when you look, there are really only two big approved successes, right? Finasteride and minoxidil. But they have wildly different reputations.
Completely different. And that distinction is key for critical thinking here. I mean, we have to remember our source material makes it clear that over decades, hundreds of drugs have failed.
Hundreds.
So when you only have two that made it through FDA approval in places like the US and Taiwan, you have to be so critical of any new essence or unproven thing that comes along.
Okay, so let's unpack the one that causes all the fear. The oral pill, finasteride, also known as Propecia.
Yeah.
This is a systemic drug through and through.
It absolutely is. Finasteride is, at its core, a blocker. It targets a very specific enzyme in your body, 5-alpha reductase.
And its job is to stop that enzyme from doing what exactly?
From converting normal testosterone into dihydrotestosterone, DHT.
Right, DHT. That's the hormone that actually shrinks the hair follicles.
That's the one. So the drug is, fundamentally altering your body's hormonal system to stop that process.
And that's where the risk comes in. This is where we hear about post-finasteride syndrome, or PFS.
Precisely. And the reported symptoms are serious. We're talking low libido, erectile dysfunction, depression, anxiety, even cognitive issues like brain fog.
So where does the irreversible part come in? That's the word that terrifies people.
Well, that term is used because of reports that these symptoms continue. They just don't go away, even after someone stops taking the drug entirely.
But I've read there's a debate in the medical community about whether PFS is, a distinct, real syndrome.
Yeah.
So how do regulators like the FDA handle that?
That's the critical point. Because the drug messes with a core hormonal pathway, the potential for severe side effects is high, even if the number of people affected is low. So the FDA has to mandate warnings. The reported effects are just too serious to ignore.
Okay, so that's the systemic hormonal approach. High stakes. Let's pivot completely then.
Let's do it.
The listener asked about the topical treatment, minoxidil, Rogaine. Does this carry any of that same kind of irreversible hormonal risk?
No, absolutely not. Its mechanism is, well, it's in a completely different universe. It doesn't touch your hormones.
I find the history on this one fascinating. It wasn't even for hair at first, was it?
Not at all. It was developed in the 70s as an oral pill for severe high blood pressure. The hair regrowth was a total surprise, just a side effect they noticed.
So if it's not blocking DHT, how does the topical version actually work?
The best theory we have is that it's a vasodilator. Think of it like opening up tiny little roads in your scalp.
So it's a local thing.
Entirely local. It widens the micro blood vessels, which rushes blood flow and nutrients to the hair follicles. This just helps them stay in their active growth phase for longer. It's changing the local environment, not your body's hormone balance.
Which means the side effects are also totally different. Local, not systemic.
Correct. The side effects are usually just localized skin irritation, a rash, burning, itching, maybe some crusting where you apply it. And crucially, once you stop using the drug, those local symptoms gradually fade away.
So it is definitively not associated with the irreversible issues we see linked to finasteride.
Not at all. And connecting this to the big picture, the contrast couldn't be more stark, really. The systemic drug demands a high-risk warning. The local drug, it presents low severity, localized irritation. It shows you the value of knowing if a treatment is local or systemic.
So the big takeaway here for anyone researching this is to always ask that question first.
Exactly.
Does this thing have decades of proven safety and efficacy data behind it? Or is it just generating hope with very little understanding of its potential to affect your entire system?
And here's a final thought for you to chew on. Considering that even after all these years, the precise biological mechanism for minoxidil isn't fully understood, what incredibly complex hurdle is making it so difficult to find a third, safe, and truly new drug for hair regrowth? Something to explore on your